further ado, I'm going to turn it over to our Director of Medicare, Omar Flores Cordero, who will be teaching you everything you need to know about Medicare Connector.
Thank you, Sarah, and welcome again, everyone. We are very happy that you are here with us and joining us this morning, to go over the Medicare Connector tool. And like Sarah said, I'm the Director of Medicare here at LeClair, and I myself have been an agent previously. And as I worked for one of our carriers here in Minnesota for 12 years, and then I came over to LeClair. And in that role, when I was selling, I was actually using a connector-based platform, so very familiar with it. And then also our people here, Renee was also an agent, and then Sarah and Ashley are very, very well versed in the platform. So please ask your questions. And just a little preface here. So this year, what we're trying to do, we want to bring these trainings to you today. We're going to do kind of an overall overview of the platform of Medicare Connector. And throughout the year, we're going to have more sessions that are going to drill down to specific aspects of the platform. And then we're also going to have some more kind of open forum sessions where you can come in and as you are using the platform, kind of come in and ask your questions more in a live format. So we'll be here for you as you're going through it. So I'm going to go ahead and share my screen here. That should just take me a second. And if I can just get a quick confirmation that you guys can see my screen.
We are seeing LeClair FMO. We get you. We got you. You got this.
All right, perfect. So the first thing is, how do you get to Medicare Connector? And one of the first places you can go is through your agent, LeClair agent portal. So you go to leclairgroup.com. And if you have never gone to your portal or you have never signed up, please talk to your sales relationship manager. Or if you don't know who your sales relationship manager is, feel free to contact us and we'll get in touch with you and make sure that you get registered. So once you log in to the portal, there's going to be a lot of things that are here. So you get to your main page and it shows you any policies you may have, who's your relationship manager, and then you can go and see all the educational events. This is also where we post these seminars once they're recorded, and then future events. You can see our articles, and you can see our tools and resources. Just a quick note here, some very helpful things. There's a copy of the scope of appointment right here. Sometimes you may have a client that just pops in and you don't have a scope of appointment ready. Here's a copy of it, and you can print it out, use it if you'd like. And then also we have a lot of tools here, handouts, and our agency marketing platform. So lots of things here to help you in your business as you're selling health insurance. And then to access the quoting tool, it's going to be here under Medicare. This is going to bring you to Medicare Connector. So Medicare Connector is what we call kind of our suite of quoting and enrollment tools for Medicare clients. So we have both the CSG quoting tool and the connector tool. We're going to spend most of our time on connector today. So just so you know kind of why we do that. So in this tool, the strength of it, it's going to be on prescription drug plans and Medicare Advantage plans. You also can quote and enroll some supplement plans on Connector, but we also offer the CSG quoting tool because it has a few other things for Medicare supplements that we think that you might find useful. At the end, I will quickly kind of show you a little bit of that CSG. So you just check here, and then it's gonna go ahead and have you log in. Your username is gonna be your NPN number, and then the password that you have created. If you have never accessed the system, please talk to your sales relationship manager or reach out to us, and we'll get you access. So once you log in, you're gonna get into your dashboard. So why should you use the connector tool? So this is a quoting and enrollment tool that's gonna allow you to save your client's profile. It's gonna allow you to save their scope of appointment, their prescription information. If you do an enrollment, it'll have a copy of that enrollment in there, and then you can also put notes in here. So there's going to be a lot of information that you can store in one place so that when you are going through open enrollment, let's say, you do an enrollment this year for somebody that just started on Medicare, and then AEP comes around, you can pull up that client's profile, and everything's going to be right there in one place for you. We've also seen that agents that are new to the business and use online enrollment tools, they do up to 63% more business than agents that do not use online enrollment tools. For current agents that just start using it, we've seen that that's about 36% more business that they do. So there's a lot of potential here for you to streamline your processes, make you more efficient, and be able to help your clients in a better way. So when we're in our dashboard here, you're going to be able to pull reports, use the Plan Smart feature. I'll talk about that in a little bit. And then also there's training materials, or there's videos here for you. And then you'll be able to access any quotes that you still have open and scope of appointments. As you can see, I have a lot of test ones that I've done that I keep handy here now to show you. Up top here, this brings you back to the dashboard. You can go see plans, search for clients, and then create new profiles. So there's three main ways that you can use the connector tool to search for plans. So the first way is going to be you just want to look for a plan quickly. So this is where you would go. You would click on plans, and then it's going to ask you for a zip code. So I'm just going to put the zip code here for our office in Woodbury. And then right away, it's going to start telling you how many plans available in that zip code. Going to have the year and the county. Now, these plans that are showing up here are going to be plans that I am contracted through LeClair to sell, and that are available to be sold in this market. So if you have a client that maybe has a plan, let's say that we're in open enrollment, they have a plan that you are not contracted through LeClair, or you are just not contracted to sell that plan, you can still add that plan under add non-licensed plan. And that way you can still do a quote, you can review that plan and compare it with other options. So this allows you to see what else is out there in the market. And then sometimes people will go in, an agent might go in and see and pull up a zip code and see, oh, I see that this plan is available and it looks very competitive. Let me add that to my portfolio. And then you can talk to your sales relationship manager here at LeClair, and we can get the contracting going for you. So right away, when I pull the plans, there's going to be different tabs for the different types of plans. So this is MAPDs. These are medical only. If you are in a county or searching in a county that has cost plans, the cost plans will also show up here, the medical only ones. Part D, prescription drug plans, Medicare supplements, and then we're working for in the future having more of the dental, vision, hospital indemnity available here. When you search, each plan is going to have its own card. And in here, it's going to have just a snippet of the basic information of the plan. If it has a deductible, out-of-pocket maximum, any highlights of the extras. The premium is right there. And then also when you click on view more details, it's going to give you your star ratings. And then also if you had put any prescriptions or anything, it's going to start giving you some more of that detail here. When you click on view all plan details, then here it's going to start giving you more information. So on this page, the information that you're going to see, it's going to be kind of like what you would get in a summary of benefits document. So it's going to be the details on out of pocket, what are the copays for the different types of services. It's also going to go, if the plan that has dental, they also will list that here. So it's going to go into some of those extras as well for you. Prescription drug coverage. And then this is one of my favorite things. It's going to have pertinent links for you. So provide the carrier's provider directory, prescription directory, pharmacy directory, and the plan documents. So I really love that it gives you a link. Most plans will have this evidence of coverage right here. So when I was an agent, this is a page that I would use all of the time. Oh, it looks like there's something wrong with my browser on that one. We'll look at a different EOC here. So I will go, if a client came in and said, you know, what is the coverage for the diabetic supply, you know, in this plan? And I would be like, well, okay, I don't know, but I know where to find it. That's in the evidence of coverage document. So here I'm looking at this plan. I got the evidence of coverage, a tip for you is going to be do Control F. And then that's going to bring this box that it's going to help you find. So you're going to type diabetic. And then this is searching for that word in the document. So now I'm going, okay, so there's a diabetes screening, diabetic self-management, services, and supplies. So then now this document gives you the answer to most of the questions that your client is going to ask. So in a normal world, if you didn't know the answer and you didn't search this document, you'll be either calling us, calling the carrier to try to find the answer. With this, you can get the answer right away while you are with the client, and then you can move on, hopefully close the sale, and do it all in one day. So it makes you a lot more efficient. So love that there's a lot of those links right there. So far, we have looked at the plans very quickly. You only put a zip code in, you know, this is, you're kind of shopping and just trying to see what's available in that area. The best practice that we would say would be to create a profile for your client. So how you do that is you click on new profile, and there's a couple ways of doing that. So one is for you to plug in the information yourself, and this you click new beneficiary. And then there is another way of doing it within the Retire Flow platform. So That is a new tool that we brought in last year. That it's basically a survey that you can send to your clients, and it's basically a link. They click the link, they answer the questions, and within those questions, there's gonna be their providers, their prescriptions, and a scope of appointment. So once they complete that survey, it's gonna come back and talk to Connector. And if this is a new profile, we'll put it into the new profile. Or if it's a current client, you can do it from the current profile. You can send the survey, and then it will update the information right there. Now, I do have to let you know there is a fee for using Retire Flow. If you need more information, contact your sales relationship manager, and we can get you plugged in with Retire Flow. For now, I'm going to show you how to create that new beneficiary within Connector. So you click on new beneficiary, and then you start plugging information. There's some basics here. So zip code, first name, last name, date of birth. That's the bare minimum. If you're with a client, try to gather as much information as you can. It will make it easier and faster once you're doing an actual enrollment. You can also, check eligibility. This is not required. As you see, there's not that start by it. So you can skip that most of the time. You don't need to do that. From here, you can either go to scope of appointment, or you can go straight to add preferences. So I'm gonna go back and I'm gonna pull one of my profiles that I've created so that I can show you. All right, so I've created a profile for a client. This client seems to have my name, but it's much older. So from the profile, you can see everything that I've done already. So I've sent a survey via Retire Flow. I've also done a scope appointment through this system. I've created notes on, hey, I texted a scope of appointment. Okay, I still need a Medicare number. So you can add notes here, and you can also add tasks. There's some tasks that are completed, so follow up on scope appointment. There's some tasks that are still due. Also, if you send a quote through the system, here's where you would see kind of the documentation of what quote you sent. So it's gonna give you when you sent it, where did you send it to, and what is the plan and authorization code. So when you send the quote through Medicare Connector, it is gonna link to this profile. So any information you've already put in here, that client is gonna be able to view it. So we'll talk a little bit more about quotes later. Here, you can also see the enrollment. So if you have done an enrollment through the Connector system, then much like this quote, it would show a box here, and it would have a copy of the PDF of that enrollment form. So next, we're gonna see what is the scope of appointment. What does that look like? So if you decide to just do it through the Connector system, you can send it, you can email it, and or text it. You can, as you can see, I have tried it many times through this profile. So here's one that is completed. So what that's gonna do, it's gonna open the completed form. So the client has already completed their part, and then now it's asking me to plug in my information, initial method of contact. So we can say past contact, and then the plans that I discussed during the meeting, and then the date of the appointment. So something that is good to remember is you send the scope to your client, they sign it electronically, they send it back, and then once you had the meeting, you'll go back to the profile and you complete the scope of appointment. Then I submit the form. What that's gonna do is gonna finalize that scope of appointment, and it's gonna say here, completed in person, so that has today's date, it has a confirmation number, and now it gives me a link to view that scope of appointment. So if a carrier comes in and asks, hey, can we see a copy of that scope of appointment? Here it is. You have it right at your fingertips. So once you have completed the scope, you can go into add preferences. And this is, where you as an agent can go in, and this is gonna be a lot about suitability. So we're gathering information from your client so that you can really look at the different plans and see what is the most suitable plan. So first it's gonna ask, this is gonna be questions about, what type of plan are they interested in? And the questions that follow are gonna have to do with are they getting any extra help, or are they on Medicaid? So are they on any other programs? So you can select that here. Then you can click continue, or you can skip on the left-hand side. You can just skip straight to go to plans. The next category is going to be health. So you can ask the system to estimate medical costs. How does this help you? This is going to create a really nice grid for you, and it's going to plug in the benefits of each plan and kind of estimate how much are the copays, for this person during the year. So depending on, you know, how much is the copay for chiropractors. So I put here, there's 12 visits. You can go here and update the answers, and you can change it. We'll go ahead and leave it in what it is, but let me just show you what it looks like when you update. So it just allows you to edit. And, you won't do this with every client, but you may have some clients that come in with that nice Excel sheet, and they tell you exactly how many visits they normally do. They think that they're going to have a surgery that's outpatient, maybe it's an inpatient hospital stay, and then you can start plugging in some of those numbers there for you. So once you update, you click continue, and then you can plug in providers. So as a general rule, we do recommend that you search for providers on the carrier's website and provider finder tools. At this point, there's been some issues with the naming conventions that different carriers will use for the carriers. So we don't recommend at this point to use the provider tool. And they are currently working on making this part of the site better. So hopefully later this year, there's going to be a big improvement on this. But at this point, we do recommend you go to the carrier's website. The nice thing is when you're looking at a plan, the links to the carrier's provider finder should be there on their plan details. So we'll go ahead and skip this part for now. But on the prescription drug side, this is really a strength of Connector. So in here, you can plug in medications. If you've used other tools like Medicare.gov, or some of the carriers use similar tools, this should feel very familiar, but the basics of how this works is you start typing the name of the drug, and then it's going to start giving you options of different drugs that have that spelling. You click on it, and then it's going to give you the options of the dosage. So how many milligrams, how many per month, or you can, if it's something that somebody gets once a year, twice a year, whatever it is, you can also change that here. Now, this is one of the places where we see the most questions. So what I mean by that is sometimes we may get a question saying, something looks funky with this client, and we'll go in and start looking at it. And it's really important that you, as the agent, just take an extra minute and pay attention to how many milligrams. Is it the capsule versus the tablet? How many per month? Is the frequency correct? Because in most cases, it was just a simple thing that somebody selected the 10 milligram instead of the 5 milligram or something, and maybe one of those is covered and the other one is not. So just taking an extra minute to make sure that this is accurate, it's gonna go a long ways. And normally, if I pull a prescription drug list and something looks off, like it's a drug that's showing not covered on every single plan out there, the first thing I do is I go and look, okay, did I select the right one? And 99 out of 100 times, it is that I selected the wrong thing. So I've already loaded a whole lot of prescriptions for Omar here. So he is in poor health. So we're gonna see what this comes up for our client Omar here. But before doing that, we had to select the pharmacy. This allows you to select up to 3 pharmacies. You can also change the zip code. So sometimes where somebody lives is not the same zip code as where they go to pharmacy. So you can change that here. You can also search by name. And if you change the zip code, so maybe I'm going to a different zip code, and this happens a lot in rural areas, you may not have in that specific zip code, you may not see any pharmacies. So you may have to zoom out. When you're zooming out, just make sure you zoom out first and then search this area, and it's going to kind of refresh for you and then give you a complete list of all the pharmacies around that area. You can view a list, and then there's more pharmacies right there. You can select your pharmacies, and then when you're setting one as primary, what that means is that when you're searching the plans and when you're looking at stuff, it's gonna first show you that pharmacy, and then if you want to compare it to the others, then you're gonna have to click on a tab for that. So we'll go ahead and continue. So far, we've looked at plans, quick search. Now we have created a profile. We've added prescriptions to that profile. We have a scope of appointment for this client. So after you've done all this work, now let's see the fruits of your labor. So this is going to start giving you some recommendations, and you can sort it by plan premium. A popular one would be this total estimated cost or estimated drug cost. So as we know with Medicare Advantage and also prescription drug plans, the cost is normally what's driving the decision. So whether the drugs are in the formulary, so they're covered by the plan, and then also how much is it gonna cost the client. So for example, for our client Omar here, it looks like this plan with a $51 premium, it's gonna have $17.84 in total estimated annual cost. This number includes the premium, and then just the drugs are gonna be right here, 306. And then you might be doing some math in your head. Well, 51 times, right now it's calculating for a February effective date. And you can see that on the left here. If you need to change that, you can change that to a different month. And let's see what that does. It's gonna spin the wheel for a little bit, calculate again the numbers for you. And that feature is nice because then, you may have somebody in your office that it's either coming off employer plan later on in the year, or they start Medicare later on. So then now the total annual cost went down because there's less premium that I'm paying. And also less prescriptions I'm getting. But this is also calculating how much I'm gonna pay in the copays that I put. So earlier I said some things about my health. So let's go look at that. We're gonna view all plan details. So now it's giving you some of those details. The premium, partial year for drugs, and then here's the health cost. So those copays, and then the total estimated cost. We saw the screen earlier. This is the plan details, but here's the meat and potatoes, the prescriptions. So I love these tabs. With this first one, it's gonna tell you what tier the medication is, how much is the retail cost, and then how much is the cost during the initial coverage. And once they hit their out of pocket, that catastrophic coverage. So tier ones, those are nice. Zero copay, we're good. It's also going to tell you if there's a prior authorization required. And then if you forget what that means, you can just put your mouse over it. It's gonna detail that. Quantity limit or step therapy. So while you're talking to your client, you can let them know, hey, this is this may require that prior authorization. Your doctor's gonna need to send a note to the pharmacy and to the plan. Now, tier 3, now these are a little more expensive medications, especially this one right here. So you can see that retail cost, and then this plan, it's only a copay for those tier 3s, so that's great. And there's also some caps going on for this Lantus here, some special things with the plan. So it also details if it's a brand or generic. From here, if you see, oh, something looks really funky, like maybe I have put the wrong thing for that Xarelto, you can go back to edit your prescription drugs right from here. Also, from at any point here, this is something Ashley taught me. You can click on the client's name here. So this one right here is the client name. This is the agent name up top. But in the client name, you can go back to any of the preferences, even back to the profile, scope of appointment, or the cart. Next thing here is going to be the health cost. So you spent your time putting in how many visits they had. So now here we have a nice grid saying, well, if you visit 12 times the chiropractor, that's 240 in copays for the year on this plan. So what this is going to do, and something good to know, the logic behind this is going to be based out of how many visits in a year. So make sure that you're accounting for that, especially now that we're in the middle of the year. So make sure you're plugging in everything that's for a year, and then this is going to go ahead and bring it down to the estimated. It's gonna prorate it, so these are the year, and this is if you started in May, this is about how much you would be paying in copays. Next thing, total estimated cost. So I also love this view. This is gonna have a month by month breakdown. So you can clearly see what's going on here. So in May, June, July, 236.33, and then it's going down to 134.33. So you can kind of guess what's going on here. They probably went from the initial coverage and met their out of pocket, and then they're paying zero. Let's see. Yes, right here. So a normal month, it's gonna give you here, that's how much they're in copays, and then they met their out of pocket, and look at what happens. Boom, zero. You may say, well, the premium's 51. Well, they're still going to the doctor, so it's still accounting for about $83 in copays for doctor visits. That's what that means. So some people like to have that view. Some agents don't like to have it. So if all of a sudden you're getting confused with the numbers, don't worry. You can go back to the preferences, health, and in here you can say, no, don't estimate the medical cost, and then go back to the plans. So the nice thing about this is that everything's customizable. So you can plug in all this information, and you can give your client different views, and there's a lot of different ways that you could use this tool to explain to your client, you know, what plan may be good for them. So now that I took out that estimation of the cost, look what it did. It actually brought a different plan up. So that does highlight the importance of you as the agent to gather as much information as you can about your client's suitability, because that could sway the numbers, and it could be a perception that one plan may be a better fit than another plan, just because you haven't taken into account the copays for the different types of services that they may get. So let's go back to that same plan. Just want to show you that grid. So here we go, view all the plan details. And then here's that total estimated cost. So now it's straight just the drug costs and the premiums. So now you should see that 153, and then goes down to just the premium. Boom. So different agents have different styles of what they like to show the client or how they want to present it. So it's all up to you. So now we have seen how to search for a plan quickly, how to create a profile for your client. So the next step here, it's going to be, you talk to your client and you want to send them the quote. Well, you can send the quote right from here from this view, or you can go back to all the plans. So maybe you wanted to send them a quote comparing options. So often you may have a couple big contenders. So maybe this one, maybe you want to do a Blue Cross. and then HP. So you just click, check the box, compare. You can either compare now, or you can, if you already know that you're gonna send the quote, click on add the quote. So I'll show you the add quote first, and then we'll compare them. So here's add to quote, and then add to quote. And what that is doing, it's putting them up here. So you can see, you can send a quote. If all of a sudden you decide, well, actually, this one's a little too expensive, so actually we're just gonna take it out. So we'll quote only these two. So from there, you just click send quote. You're gonna confirm the email again, and then or the phone number to text. And then you can add a message right there. And then you can select what pharmacy you want to show right away. The client is going to be able to toggle between them. And I will let you know, we do plan on having one of these sessions drill into what is the client view once they receive the quote. So that's upcoming later this year, that we'll be showing that. But I do recommend, if you're just getting started, or even if you use this system before, like, try things out for yourself. Create a dummy profile, plug in your email, send yourself a quote, look at, what is the experience. Because the best thing you can do is tell your client, you're gonna get an email from this, you're gonna get a code, and then you're gonna be able to view your quote. Once you're ready, if you want your client to go ahead and enroll themselves, they can click on that themselves, or you can give them instructions, look at it, and then, but just come back to me and I will help you with the enrollment, whatever you want your process to be. But make sure that you go through the screens, see what the client is going to be getting, so that you can give them good instructions on what's next. So you can send the quote, or if you're gonna compare them, so I just click there. What this is gonna do is gonna put them side by side for you. Gonna bring you to that plan details screen. And from here, once it populates, it's gonna actually highlight what are the differences. So here we go. I had selected 3. So now you can show plan differences, or you can turn that off right there. So it's kind of a light version of that plan details page. And from here, I think, it's going to give you enough information where, you can decide, okay, I want to drill in more into one of these plans. So you can click on that, or maybe, you're at the point where the client's deciding, I'm going to go for that plan. So then you can add to the cart. So far, we have seen how to quote. If you are contracted with LeClair to sell this plan, you're going to be able to add it to the cart and do the enrollment through here. So that is all electronic. Each of the carriers, they have their kind of their own enrollment form criteria. But the nice thing with Connector is that it will guide you through all of the steps, and it's going to make sure that everything that needs to be filled out is filled out, and also that it's being sent to the right place. So that it's a strength of doing online enrollment, and that it's going to make sure that things are done correctly, everything is filled out, and it's going to minimize errors that normally don't need to happen. So some examples might be, if you're doing a paper form, how many times you've had somebody that fills it out but then forgets to fill out their birthday, or forgets to put their address for some reason, then you kind of have to go back, ask for it, and whole rigmarole. And here it won't even let you go to the next step. The other thing for you, for all of you that are doing phone enrollments, so one thing is this system, it does not do the recording. Okay? So you need to have your own recording platform, be it, however you get that. So it can be like at Teams if you're doing Zoom and recording through that, or other subscriptions. But it will tell you everything that you need to say to a client to be compliant. What I mean by that is I'm gonna quickly add to the cart here. I'm gonna show you some of the prompts. I'm of course not going to submit this. So if you're doing a dummy kind of account here, please do not submit to the carrier. They frown upon that. So, but I'm just gonna show you the initial screen so you see. So I'm gonna complete and submit the form myself. Continue to apply. And then the next thing here, it's going to be the enrollment form. So UCare provided an enrollment form to put in the system. Again, it's gonna be linking out to some of those documents, like the summary of benefits that you have to give to your client. So here, right away, it's gonna tell you, do I have permission to record this enrollment? So this is something you're asking the client. So if you say yes, then it'll keep giving you all the notes on everything you need to cover through while you're recording the phone call. And then as you go, you're gonna be checking the boxes. Yes, I just said this. Yes, I just said this. Blah, blah, blah. And continuing on. For those of you that do phone enrollments, you know how sometimes it can get tedious, you're reading through, but there's a compliance piece here. So we want to make sure that you are compliant with CMS. And if the carrier ever comes back and says, provide me a recording of this enrollment, then as long as you follow the steps, you should be in compliance there. So we're really kind of watching your back on that, and that's part of our service for you. So then you can continue applying, and then you can see how everything that is required is going to have those stars. So from this point, I'm not going to continue because I don't want to actually submit an enrollment, but I'm going to show you. I told you there was 3 main ways you can interact with this. So we talked about 2, just searching for a plan quickly, creating a beneficiary or profile for the client. And the other one is that this tool allows you to have a unique URL or link that you can either put on your website or send via email to your client. And that is going to be, you click on your name at the top. So that's your agent name up there. And then you go to account overview. So from here, it's going to have your personalized link for your client. So I just copied the link. And then I'm going to paste it. So you can paste that into an email. You can post it on your website. Just make sure that you're pasting it from the one that you took on your account. And then from here, you can put this, the client can go in, they can see your name at the top, and they know that they're in the right place. They can see your email, and then they can go shopping. So if they do an enrollment through this link, it will have your agent information. So you will be the AOR as long as it follows all the AOR rules. But it will have your agent be attached to you. So that is another way that you can use this. Um, just a recommendation, if you're using that, just let your client know. Make sure that they can see your name at the top. They will know that they're in the right place. So I know we're almost at time here. So we have seen that the three main ways of using this. So just looking at a plan quickly, creating the profile, creating your own link, and then one last piece. I promise you I was gonna just show you very briefly CSG. So I'm gonna do that here. So actually gonna go to my, you can save this once you get to that Medicare connector site, you can save that in your favorite so that you can just go straight there when you have a client. So CSG is the tool that I said, it has some really cool stuff for Medicare supplement. So in here, you can go to Medicare supplement, run quote. I'm just gonna quickly put a zip code, effective date. And we also have a training out there that goes into greater detail into this system on our portal. So make sure you check that out. But just quickly, the thing I like about this is you can quickly search for a plan, especially if you're in Minnesota and or Wisconsin and you know about the riders. You can quickly pull the riders in. It's changing the price live as you're clicking them. And then it's going to give you information about that carrier. So in here, it's going to give you that historical information and also how many lives are in the state that have Medicare supplement through them. And that's important information because sometimes that Medicare supplement client may be concerned more about, how much are the increases normally year after year for this plan. Have they been in business for a long time, or is this somebody that just came in new, etc. So lots of great stuff. Make sure you go out there. For CSG, you have to request the access, so go request it. And uh, if you have any questions, feel free to ask your sales relationship manager. So with that, now I will stop because I see the ladies are here.
We put our faces up here to let you know we're ready.
Yes.
Well, thank you so much, Omar. I know Medicare Connector has a lot of features on here, so it's a little difficult to go through and kind of highlight all of those. And I think Omar did a fantastic job kind of touching on those key areas. We're going to quickly wrap this up here. There were a couple of really great questions that came through, which we were able to address. First and foremost, we are going to attach that Engage brochure to the follow-up email so that you'll have it. You can do the QR code from there, but you will have a copy of that sent out to you. And then there were two other ones that I know Omar addressed, but just to touch on briefly. So the way Connector works is that you should be able to view all of the plans in an area by using that search plans feature. But the ones you are contracted with through LeClair will be the ones that you are able to enroll a client in. And in that aspect, it kind of acts a little bit like a CRM for you, kind of holding that profile information and showing those enrollments. But you can see everything available, even if you don't have that contract or if you don't have it through LeClair. The other one on there was just briefly mentioning how it would be nice if all of the carriers had automatic payment options. 100% we agree with you. I think that's an example of the great feedback we get from agents who are out there using this tool. We always bring this feedback back to Connecture. This is one we've mentioned before. They are aware of. It's a little bit of a tough situation because we're at the mercy of the carrier sometimes for those features, but rest assured, we are your biggest advocate in terms of making sure this tool works for you the way you want it to. So please keep on providing any of that feedback to us. So wonderful questions. We thank you for hanging out with us for an hour. watch for that follow-up email this afternoon. It will have the Engage brochure with all of the events. It will have a recording of this if you wanted to watch it again and hear all of that information Omar provided. And then finally, it's going to have links to our next monthly Medicare Connector training. It's going to be on February 13th. We'll have a link to register as well as just some information on upcoming topics. So this is going to be, get ready for a fun year of trainings with us. It won't always be Omar, so positively, negatively, if you love his melodic voice, but we're all going to be presenting on topics. So let us know if there's anything you want to hear. Let us know if you have questions. Let us know if you love our outfits. We appreciate any and all feedback. And we hope you all have a wonderful day. Thank you, Omar, for taking us through it. Thank you, Ashley and Renee, for grabbing those questions. And thank you to all of you for everything that you do. And we hope to see you soon. Bye, everybody.
Bye.
Thank you, everybody.